Let's get out of views on this. Jack Blum is the Gauteng provincial spokesperson for the Democratic Alliance on Health. Sibongile Tshabalala is the national chairperson of the Treatment Action Campaign. Good afternoon to you both, and thank you for your time. Sibongile, if I may, I'll start with you. When we have a massive hospital like Hani Baragwanath that doesn't have enough bread runs out. What does this tell us about the health system in Gauteng?
This tells us, let me start by saying thank you very much for having me for this interview. But what is happening in Gauteng shows what we've been talking about for a very long time, to say the healthcare system in South Africa is collapsing. And it has collapsed now. We are at that situation where our healthcare system it's totally collapsed, and it tells us that there is no political will in the province. Because if we were listening to a long time ago, these challenges that we are facing today, we wouldn't have them. But because we have irresponsive government, we have people who don't care about people's lives, they only care about how much are they getting into their pockets. That is why we are in this situation. And also we need to hold now even the Premier of Gauteng to say he's been there driving this ship, and we've been complaining to him, we've been trying to meet him, but he never availed himself, because he doesn't care. He cares about other things and how are they getting money, how are they stealing from the public purse, but they don't care on how people are getting services on the ground.
Jack Blum, how do you think we got here? I mean, Hani Baragwanath it should be a symbol of what this country is trying to do to ensure equitable health care. It is a massive hospital. It treats people in Soweto. If ever there was a symbol of what this country wants to aspire to, it should be that hospital. Here we have a hospital running out of bread.
Well, absolutely, Stephen. It's just incomprehensible. In fact, when I first heard about it, I didn't believe it until I confirmed with some doctors at the hospital. Look, I agree with the TAC. The Gauteng Health Department has been a shambles for many, many years. And actually, the ultimate responsibility does lie with Premier David Makura. 8 years ago, when he became Premier, he said he would look for an urgent turnaround. That was his actual words, an urgent turnaround of the Gauteng Health Department. 8 years later, and, after Sedimeni and the PPE scandal and other scandals, look where we are. We have our major hospital. It's not just running short of bread. It's running short of other food. There's laundry problems. And at that hospital, as we speak, there's waste, medical waste piling up around because the company hasn't been paid. What's happening is that result of poor financial management and incompetent people and frankly, a massive amount of corruption. Towards the end of the financial year, the government's financial year ends at the end of this month, they run out of money. It's called the dry season, so they can't pay suppliers, and this is what happens. Medical waste builds up around the hospital, not just Hani, but other hospitals, and they run out of bread. I really think once and for all, we've got to put the right people in the right jobs, cut out all the corruption, and make sure that money is spent where it should be spent. There's an enormous budget for Gauteng Health. It's 59 billion rand, but unbelievably badly spent, I'm sorry to say.
Sibongile, I mean, do you agree with that? Is there enough money? I understand that the Gauteng Health Department has a huge patient load. I mean, Hani Baragwanath does, but the Gauteng Health Department does. It takes patients from around the country and, in fact, from around the southern African area. Does it have enough money? Is it just a shortage of resources? Or do you think, as Jack does, that there are issues with management?
I don't think there are shortages of resources. The question here is where the money goes. For instance, in Gauteng, as Jack is saying that this is our financial year end, next month we'll be getting new funding, but all that funding before the end of April, it will be done, it will be finished, because they are paying accruals. So even then, they admit that every year when they get the budget for that year, they pay accruals for previous years. So it means every time a Gauteng gets a budget, they can't be able to use that budget. One, it's issue of negligence that is happening in hospitals, where government has to pay for those negligence cases. And if you can look at how much Gauteng is paying for negligence cases, there's a lot. But also the issue of corruption, we cannot divorce that from what is happening now. Money is being stolen from the public purse. We remember the issue of Brian Hlongwa, that money was never repaid to the public purse. The money, the PPE scandals of Bandile Masugus, that money was never recovered. We know that there are machines that were bought for cancer patients, which are bought without even maintenance. They are unable to maintain those machines. So how can you buy a machine without knowing how are you going to maintain that machine? How are you going to use that machine? So it was an issue of corruption because somebody was getting something out of that. So the issue of money, I don't think it's a problem. The problem is how we service people, how this money is allocated. That is the problem. And if they allocate correctly, if we make sure the government that we have enough staff in hospitals, the negligence cases that the government is facing will reduce. If they make sure that they strengthen their system in terms of anti-corruption, then we could save so much money onto that. So there are a lot of things that we can save on in terms of providing services, but because they're only interested where they will be able to put their hands and steal, that is why we're in this process, in this program. I still believe, and TAC, we still believe that South Africa doesn't have shortages of money or something, but it's how are we allocating funds and how are we prioritizing services on the ground.
Jack Blum, you talk about a dry season because people in the Gauteng Health Department know, and particularly Chris Hani Baragwanath know, that the budget's going to run out until the next financial year. But all of this is foreseeable. The money is allocated for bread. How can suddenly there be no money allocated for bread? I mean, this is a very simple thing.
Well, absolutely. I mean, running out of a basic staple is just unbelievable. But let me give an example of corruption and wastage of money. At Chris Hani Baragwanath Hospital, 500 new beds were built using alternative building technology. This was supposed to be for COVID-19 patients. Well, they're not staffed and they're empty, and now they don't know what to do with it. That's 500 million rand, half a billion rand. And then on the West Rand, the famous case of the Anglo-Shanti Hospital, they've spent about 700 million rand on that, hundreds of million rands elsewhere. I mean, they're just blowing money away. And then, of course, the PPE corruption scandal. This is absolutely billions of money that we're looking at. And here, I quite agree with the demonstration at the hospital today, because the hospital is short of staff, they're short of resources, and they know, that they're crooked people there. What can I say? There's crooked people there. We had Babita Diakaran, who was assassinated last year because she was one of the honest civil servants there. We haven't had further progress on finding out who shot her dead. But I'm afraid to say the problem continues. There's an acting chief financial officer at the department as we speak and an acting head of department. How can you run a department unless you've got, permanent people in key positions? The shambles is just continuing, and 8 years later, lots of promises from Premier David Makura. It's just getting worse. That's all I can say. I think I don't even want to look at the news anymore about what more is happening, or get another call from a doctor or nurses. Ultimately, patients are suffering. People are dying. The continued closure of Sharpenkreke Johannesburg Hospital, I think, is worse than the Life Esidimeni tragedy. I think thousands of people are going to die because they can't get heart treatment, they can't get cancer treatment, all sorts of specialist treatment. And here the provincial government had to admit that they can't fix the hospital themselves, so they're giving it over to the National Health Department. I really think something drastic has to happen, and the demonstration today at Chris Hani Baragwanath Hospital was fully justified.
Jack Blum from the Democratic Alliance, a health spokesperson in Gauteng, Sibongile Tshabalala, National Chair of the Treatment Action Campaign. Thank you both. It's an important issue. More to come on that.